First thing I'm going to do with you is just go over the entire system first, overall, and then I'll show you the salivary glands and the teeth, and then we'll end it with that for today, so that you can work on respiration, and if you choose to work on digestion, you can. So up here, basically, again, up here, the upper airways is similar to what you saw last week. Maybe I should just leave it flat. You have the external nares or nostrils, the vestibule of the nose, and then you have the meatuses that goes inferior, middle, and superior. They're below each conch, the superior, the middle, and the inferior conch. Here is the sphenoid and the frontal sinus. Obviously, the pituitary gland and the sella turcica. Back here you have the internal nares and then the nasopharynx. And then in the nasopharynx you have the pharyngeal tonsil, and the opening for the auditory tube. That we did last week. Then you have the oral cavity here. Here's the tongue. Here's the hard palate. We're just going to work with hard palate. Don't worry about maxillary, palating process in the maxilla and things like that. Just stick with hard palate, soft palate, and uvula. Down into the oropharynx. Here's the lingual tonsil. And down in there's the palatine tonsil. So remember I told you last week that the oral cavity and parts of the pharynx are a common pathway for air and food. So here's the epiglottis again, here's the hyoid bone, here's your thyroid cartilage, cricoid cartilage, and in here you have your vocal cords. The white line is the true cords, the pink is the false cords, and the opening is the glottis. Back here you have the laryngopharynx, and this little piece up here, you almost could consider this to be the upper esophageal sphincter. There is controversy as to whether it really is one, but we could consider that. And then here's your esophagus. So laryngopharynx into the esophagus, epiglottis would have to close over the airways. So this whole thing here is the esophagus. Here's the esophageal sphincter, lower esophageal sphincter, into the stomach. And we'll talk more about the parts of the stomach next time, but just quickly for today, you have the greater curvature and the lesser curvature of the stomach on the top, lesser and greater curvature, and then the stomach is broken down into the cardiac region, the body, and the pyloric region. We'll go over that with the individual stomach models. This is the fundus, curved area, and we're going to see a fundus of a gallbladder. You'll see the fundus of the uterus, and this is the fundus of the stomach, the curved area. The stomach enters into the duodenum here, and this is the pyloric sphincter. Here. It controls, pyloric sphincter is smooth muscle. It controls food going from the stomach into the duodenum here. This is the duodenum. Okay, here's the pancreas. Here's the spleen. Gallbladder. And the liver. Okay, and we'll talk about the ducts the next time. But I just want to give you the overview here. So the liver, the gallbladder, spleen, pancreas. Spleen is not part of the digestive system. It's part of the immune system. And the duodenum. Now, the duodenum then is going to go into the jejunum. The dark pink is the jejunum. The light pink is the ileum. Because if you look at the color over here of the ileum going into the cecum, okay, the little pieces that should be sitting on here are inside somewhere. Okay, and the one that goes across. but this is light pink. So this is the ileum. The ileum goes into the cecum, and this here, this line, is the ileocecal valve or sphincter. Over here. Okay, this is the appendix coming off the cecum. Cecum, ascending colon. Now where the ascending colon turns into the transverse, this is the right colic or hepatic flexure. And then the transverse colon goes across, and then you have the splenic or the left colic flexure. Descending colon, sigmoid colon is the rectum and the anus. External anal sphincters, which are skeletal muscle. Internal sphincters, long darker pink, smooth muscle. So that's the general overview of the GI tract.
You don't have to learn the Vader, the sphincter Vader.
Yeah, we'll get to that, but I want you to work more on respiration, so I'm only doing some of the digestive system. Okay, and we'll do the ampular Vader, we'll do the hepatic ducts, we'll do the accessory duct of Santorini, and main pancreatic duct and so on, but not today. So that's the overview. Now let me have that head model there. If we start in the mouth, first of all, I'll do this again in lecture with you, but food only enters the digestive tract, which would be the mouth, the pharynx, the esophagus, the stomach, the small intestine, the large intestine, the rectum and anus. Okay, everything else is an accessory gland. The liver, the gallbladder, the pancreas, and the salivary glands are all accessory. So food never enters these structures. What they do is they secrete into the digestive tract where the food is, and they help with chemical digestion. Okay. So the digestive tract, or the GI tract, gastrointestinal, is also, you may have learned it at the alimentary canal. Okay, that sort of tube within a tube system. Okay, this tube within the body wall. Okay, food only goes through that tract. Everything else is sent into enzymes, digestive juices are sent into the tract for digestion. So as far as the salivary glands go, you can use this model for 3 of them, this one for 2. It doesn't have the parotid. So underneath the tongue, you have the lingual tonsil. Lingual for language, for tongue, lingual tonsil. Underneath the mandible, you have the submandibular salivary glands. So lingual, submandibular. The biggest one is by the ear. Here's the parotid salivary gland. Remember, you may remember from 131, parotid was innervated by the 9th cranial nerve. Sublingual, submandibular salivary glands by the 7th cranial nerve. So this is the parotid, and here's the parotid duct. Now on this model, all you can see is the sublingual and the submandibular. Take the mandible off. Here's the sublingual under the tongue, and here's the submandibular. Sublingual, submandibular. I don't know how many people actually use this, but I do. I'm like the tooth man. So, I was actually the one responsible for getting this and the other teeth model in there. Basically, we're going to go through the major parts of this. They're listed on the sheet that I gave you. Those that they came in late, I'll give you a copy of them. We're not going to worry about the crown, the neck, and the root of the tooth. We're going to go with the enamel, which the white part of the tooth,
What's the number 19?
19. Well, you got 17, I think they're looking at the crown, but 19 is the enamel. Enamel is actually the hardest structure in the body. It's actually secreted by epithelial cells. The dentin framework of the tooth is very much like bone, because if you think about where your minerals are, okay, usually it's teeth and bone. This is the dentin, 20. The enamel is actually laid down over the dentin framework. Then in the middle of the tooth here, this is probably it's a molar and it's got 2 roots. This is the pulp cavity. Okay, and the pulp cavity basically has your nerves and your blood vessels. And then in this tooth you have, well, they're not showing the root here, the root canal, but there's going to be one on either side. So this is really the root canal. And the vessels and the nerves come in through the apical foramen down here. There's a little opening here at the root, bottom of the root canal, where the actual blood vessels, the arteries come in, the veins go out, and the nerve comes in. When they do a root canal, usually there's considerable damage to the tooth. It's probably dead already. Okay? And in order to actually save the integrity of the tooth, they actually hollow out the root canal, or they take out the vessels and everything and they fill it. Basically, I don't know, they probably used to do it with, amalgam and mercury and a combination of metals and things. Today they probably do composites.
For the root canal, you said the veins go out, the arteries come in, and what do the nerves do?
The nerves are going to come in and innervate the tooth. So, basically, that's the root canal with the vessels and the nerve. Now, the way the tooth is anchored is 23, the yellow, is the cementum. And the cementum is anchored to 26, which is the periodontal ligament. Now, you may remember from 131, what kind of joint is this? Well, it's a synarthrotic joint. It's an immovable joint. Okay, more specifically, it's a gymphosis. Even the baby teeth, the deciduous teeth, should be solid. They shouldn't be moving. The only time the baby teeth start to loosen up is when the adult teeth start to erupt through the gums and push them out. Okay? So the adult teeth should definitely be permanent. If they feel loose or you can sort of wiggle them, there's some problem there. There's either a problem with the gums or the bone, something's going on. They should be solid, immovable joints. So the tooth is anchored by the cementum, 23, to the periodontal ligament, 26, which is fibrous connective tissue. Now this here, 27, is your alveolar bone. Okay, that's your alveolar socket, either the maxilla or the mandible, but this is bone. 25 up here is the gingiva or gums. So again, the enamel, the dentin, the pulp cavity, the root canal, the apical foramen down here where they come in, the cementum, the yellow, the pink is the periodontal ligament, this is all bone, and this is the gingiva or gums. We're only going to worry about this side of the model, don't worry about that. And I think with the fact that you haven't really done a lot of work on the respiratory system, okay, we'll leave it with that. And then next time we'll look at the stomach, we'll look at the liver.